Hey there, you beautiful badass. Welcome to the Carrie Croft Show. I'm your host, Carrie Croft, delivering you stories that get you pumped up and feeling like the unstoppable savage that you are. So grab your coffee, put on your game face, and let's do this thing, baby. Hi, it's your girl Carrie. I recently sat down with Nikki McCarthy, the founder and executive director of Sam's Fans. We had a great conversation about the work she does to honor her daughter Sam, who is the inspiration behind this cool organization. They're a nonprofit that supports music and art therapy for seriously ill kids and their families. In a few weeks, they're having their biggest fundraiser of the year called A Thread of Hope. Nikki invited me, so I'll be there. And it sounds like a really awesome event. Silent and live auction, great music by Conspiracy, Cameron Mitchell food, and we know how much I love Cameron Mitchell and food, drinks, and a fashion presentation by local boutique Thread. So join me there on October 24th at the Exchange at Bridge Park in Dublin for A Thread of Hope. To sponsor or purchase tickets, go to www.samsfans.org or DM me. See you there. So how many people ask you if it's really worth it to get a haircut by Mia Santiago?
Honestly, a lot. And honestly, it is.
I mean, she is a celebrity hairstylist in Columbus, Ohio. That's all you really need to know.
She doesn't miss, and now she has her own salon, Headspace. It is truly something this city has never seen.
Girl, I did one scalp treatment, and I would let Jake put his hands on my head anytime he wanted.
No, same. It's right in Upper Arlington where Mia cuts and styles, and Jake manages a full scalp spa, which is like a facial for your scalp and a massage for all of the stress and tension we hold in our head and neck.
I legit felt like I was on something after I got my first treatment, and my hair looks so much healthier now that all the buildup and dead skin are gone. I mean, I do love massages, but honestly, this might be even better. Plus, it has so many proven benefits for my hair health.
Truly believe you get what you pay for, and Mia and Jake are the dream team.
Use code CARRIE for 20% off your first visit with Miss Mia Santiago. Because if I screw this up, you guys are never going to talk to me again. Dr. Weston, welcome to the Carrie Croft Show.
Well, thank you.
How are you?
I'm great. How are you?
I couldn't be better.
That's
It's been a great
answer.
morning.
Couldn't be better.
Smooth as silk.
Yeah, I mean,
And here we are. This is really all that matters, that we're making this happen today.
That's right.
Right? And you look good.
Oh, thanks.
I like I really firmly believe that neon loves neutral. You kind of have the little neon-esque chartreuse flare with the black, and I'm feeling it.
I had to bring some color, some more color.
You're a vibe today.
Oh, thanks.
Yeah.
I'm a vibe.
You are a total vibe.
I love it.
So for those people who don't know you,
Yes.
who is this Dr. Weston you speak of? You happen to work with the one, the only, Dr. Donaldson.
Yes, Dr.
Paging
Jeff Donaldson.
Dr. Donaldson. Give us some dirt.
Dirt on
Just
Dr.
a
D?
little bit. I mean, even if it's like he leaves, I want to debunk the perfection that is Dr. D. Even if it's like he puts, he's messy, he leaves things in the, wrappers. What's one little tiny? Give us a little, just something.
Oh, gosh, something on Dr. D. I mean, he doesn't have a lot of dirt.
He's perfect, isn't he?
The good thing about Dr. D is he's the same everywhere. Like, he's the same with patients as he's going to be with you, as he's going to be, like, he's just,
Yeah.
I don't know, he's pretty full of integrity. He runs late.
There you go. See, that's all I needed was just a little bit. I just wanted a little something on Dr. D.
Sure.
Okay,
No,
all right.
he is not on time.
We will continue the digging for imperfections, not with you today, but I will continue this quest
Yes.
to find flaws in this man.
I mean, I think you can do it.
Maybe. But enough about him. Let's talk
Okay.
about you today.
Yes, let's.
So-
He's had his hour.
Yeah, he has. You know what? He's had his moment in the sun.
He's done.
It's all about you
I'm
today.
not bringing him in here today.
So you are the functional medicine side of Donaldson.
Correct.
And why don't you start with, how did you and Dr. Donaldson come together and say, hey, this would be a really great idea to put the wellness and the aesthetics together?
Yes. So it was actually not my idea. I wish I could take credit for it. I did not know Dr. Donaldson at all. And so it was my day off. I was working at Ohio Health at the time. And it was my day off, and one of our secretaries calls me, and she's like, this plastic surgeon wants to talk to you. And I thought, can't he just read my H&P? Like, I thought it was about a patient. I get out my laptop. I'm all pissed off. I'm like, fine.
Were you
So
hormonal?
Probably. So I'm getting it. And I'm like, I'm just calling Dr. Donaldson back. And he's just asking me about me, my training, and then asked if I wanted to come in and see the office because they want to add wellness. And so I got off the phone and my husband was working from home that day. And I go to my husband, I'm like, there is no way I am working at a plastic surgeon's office. I'm like, my patients aren't going to want to see me there. I don't want to deal with, I just had a preconceived wrong judgment on the types of patients I would see there. And I just wasn't going to have it. And then I went in and then I met said Dr. Donaldson. And it really is a phenomenal office. And the whole goal with functional medicine was to help patients that they could no longer help. Like they either don't fit surgery or they've had surgery, but they thought it would make them feel better, but it didn't really make them feel as good as they thought it would. And so Dr. D knew that there were this subset of patients that needed more, and he knew that was functional medicine.
Fantastic. You guys are a good pair. You're a good duo.
Oh, thanks.
For sure.
Yeah.
At least from my perspective.
The office is phenomenal. I mean, it's just the culture of the office is great. Really, patients are first. And so that's another good thing about our surgeons. So we have Dr. Donaldson and Dr. Seifer, and they don't operate on everybody. They will say no.
Doesn't it just make sense we get Dr. Seifer in here too?
She's
let's might as well do the trifecta of awesomeness that is Donaldson.
I think
just put that little nugget into the universe. So just little breadcrumbs, just drop little breadcrumbs.
I love it.
So where in your medical journey, like how did you end up in the functional medicine space where you're like, this is for me and I want to help people figure all this stuff out with their bodies.
Yeah.
Like hormonal and everything that functional medicine is.
So I think most functional medicine providers have had their own journey. And so my journey started over 10 years ago. I had my own symptoms that weren't really explained with conventional medicine. So I had labs that were abnormal, but not abnormal enough for diagnosis. I saw many different doctors, had many different tests, and still had no answers. I was told, well, we'll just recheck your labs every year. If your symptoms get worse, let us know. And I'm like, that's my plan? My plan is to just recheck every year and like cross my fingers and do nothing else. And so I jumped into nutrition. So I am sports medicine trained. I had been working with University of Oklahoma, and so had seen a lot of eating disorders and disordered eating. And so I kind of had some background in nutrition. So I started there. I did not realize what I was doing was functional medicine at the time. So that was the beginning of my journey. And then we moved to Wisconsin. We moved back to Ohio. And then it just became not okay to tell my patients that they just had to wait. Like that wasn't an okay answer for me to give anymore.
Yeah.
You know, you see those patients that like don't fit in a nice box, or they don't feel well, but their labs are normal. And we just say, well, here's an antidepressant, or I don't know, everything's normal. And we just send them on their way. And that was okay when I first started because I didn't know any better. But then being on the patient side, I'm like, that's a horrible answer. It's a horrible way to live. So I was certified in functional.
What were your symptoms?
My symptoms, I had numbness, like numb spots. I had abnormal testing of my brain MRI. I had abnormal ANA, which is autoimmune markers. So I saw rheumatology, and I saw neurology, and I saw orthopedic. So just all these doctors, and no one could really give me any answers. So
you've eventually figured out all of these things with functional medicine within yourself.
Correct. So, I mean, just kind of in that autoimmune umbrella. And so usually with autoimmune, we dive into gut health. I dove into nutrition. And so since that time, my labs have stayed normal, like no progression on my imaging, haven't needed medications. So that's my story.
So for someone at home who's feeling like, okay, this all sounds great, but I'm sure it's way too expensive. Mm-hmm. It just feels like something that other people are able to have. Mm-hmm. How can we bring this in, like your average, everyday, middle America person? How can this person dip their toe into functional medicine with Donaldson?
So we have something called targeted testing. And so it's really great for people who maybe aren't certain about functional medicine yet. Like they think they want to learn more, but I have some people that come in, they know for sure they want functional medicine. They want to dive in head first. But other people, if you've always done conventional medicine and you're like, what is this functional? I know I don't feel well. I just want a snippet of it. So we have targeted testing. And so we offer, we talk to you about your symptoms, figure out kind of what testing would best fit with what's going on in your life, and then do those tests. We have a follow-up appointment where we can give you interpretation of the tests and then give you a plan. And so the plans are usually lifestyle, diet, sometimes supplements, sometimes pharmaceuticals if needed, but usually not.
So the Dutch test.
Yes.
Let's talk about the Dutch test. You were kind enough to send me the Dutch test. And basically it comes in the mail. It's a little cardboard instructional guide.
Mm-hmm.
You have to pee on a little, it's not like a stick necessarily, like a
filter
square
paper.
or whatever. You follow all the instructions. You send it back to the man behind the curtain at the Dutch test place, whoever that guy is. And then it takes like 3 or 4 weeks to get back. Is the Dutch test with the front door that you would give to most people who are trying to dip their toe in, or what are the other ways to do it?
So it depends what people are complaining about. So if it's IBS, gut symptoms, autoimmunity, we would do stool testing, food sensitivity testing. If it's hormones, which is, a bulk of what we see, because it's our demographic. It's my demographic. I'm 45, so I'm in the midst of perimenopause. And so that Dutch test is just a great test, a great snapshot of hormones, hormone metabolism, including cortisol. So it might be, women who are going through perimenopause, things are just changing. They can't really maybe put their finger on it, but they might be having lower energy. They might have low libido. They might have, changing cycles. They might get hot flashes, vaginal symptoms, weight gain, all of those.
Hot flashes coming in hot over here.
Yeah.
I kind of like them.
Do you? Have you always been cold?
So that's the thing. It's like it feels like it's just like a self-induced sauna. I'm like, oh yeah, here we go, baby. I don't know. So far, talk to me in like 6 months, but
yeah. Are they waking you at night?
No. So that's the thing.
Yeah.
I know if they wake you at night and you're like dripping, that's not.
Yeah.
That's not
my
the vibe.
patients have to like change their clothes. They're changing their sheets.
Yeah.
That would be annoying.
No, I get them like a little bit. I think I'm getting like baby flashes.
Yeah.
Where like during the day, every once in a while, I'm like, ooh, it's getting hot
Like a little
in here.
hug. Yeah, some women might want to throat punch you hearing that because they're miserable.
So then by the time I get to that point, I'll totally retract.
I have had patients, I had one in particular send me a video of herself in her car getting a hot flash. And it's like you could see the redness like coming up and she just would be sweating. While talking to me, she was taking the video.
See, I think I might be like creeping into them.
And I just love that people are now talking about it.
Yes.
I feel like it's getting out there on social media. Women are talking about it because, the generation before us, we don't talk about that. And I love that.
So let's talk about a couple of these. I feel like there's some stigma around hormone replacement therapy as it sits today, at least in my perspective with people I talk to and the way that I feel. There's some like scare factors, right? Are you going to get cancer if you put these hormones in your body? And when I met with you, a couple things stuck out about our conversation when I sat down with you to go over my Dutch test results. And you went in great detail about estrogen and what there was a study that was done. And it was, so let's go through that whole breast cancer study. And so we can kind of debunk the myths out there about estrogen replacement.
I would say that's the most common reason women don't want to go on HRT or hormone replacement therapy is because of the fear of breast cancer. So that first started through the WHI study in 2002. That study was meant to tell us if hormone replacement therapy was going to help cardiovascular health. That was the purpose of the study. So patients were average age about 62. They were taking oral estrogen and oral progestin, which we don't use anymore. So that's number one. But they stopped the study early because of increased risk of breast cancer. So if you look at the absolute risk from the study, it was one more case per 1,000 women per year. So we're not talking dozens and dozens and hundreds of cases of breast cancer that were coming out. It was one per 1,000. Now, since that time, there have been more studies that have come out looking back at that study and, taking that data, and then further studies that have looked at just estrogen, progesterone, and risk of breast cancer. And so further studies have actually shown that in the right time frame, estrogen can actually be preventative for breast cancer. There are even some studies now going on in early stage breast cancers using estrogen as a treatment. So I think that has been debunked. Like, it's safe to say that that's been debunked, but it's taking so long for the public to embrace that. Or even some physicians.
Yeah.
Like older physicians. I think sometimes we're maybe, dare I say, prideful in like not wanting to change anything. Well, that's how we've always done it. That's, nothing can ever change. That's how it's always been. That's not good medicine. Why are we doing studies then? And before this study, 80% of postmenopausal women were on hormone replacement therapy. And after the study, it went down to 20%.
But what are all the other preventative things that estrogen can do? I thought there were other things that, aside from the breast cancer thing.
Yes. So if you have a personal history of estrogen-sensitive cancer, we're not going to put you on estrogen. That's like putting gas on a fire. Like, we're not going to give you estrogen if you have an estrogen-sensitive cancer. But it doesn't cause it if given in the right scenario and in the right age range. It is protective for heart, brain, bones. And you're more likely to die 2 years after a diagnosis of a hip fracture than 10 years after a diagnosis of breast cancer.
Yeah, you mentioned that too in my appointment, and you delved in a little bit more with that too. That's wild.
Well, it's a little bit of a soapbox of mine just because I did sports medicine. And so you see these healthy, active women, not on any medicines, and men, and then they have a hip fracture. And it's awful. It takes their independence. I mean, patients go downhill so fast after hip fractures. And so people don't think about bone health as much as they should. We're pretty quick in our office to order DEXA scans. I want to see what your bone health is because I don't want to wait until it's gone and it's too late. I want to know at the beginning when you start seeing those changes in bone health so we can try to fix it.
And I wonder, of all the people, all the ears out there listening right now, how many can raise their hand and say they've done a DEXA scan?
I know.
Myself included, which I have, that's in the works because of you. Yeah. Because you're like, be proactive about it. Yes. Why would you not want to know your baseline? And actually, if there is an issue, we have the knowledge, that is power. But how many people even know that that's available to them?
Right. I mean, insurance will cover it after the age of 65 unless you have risk factors. But insurance, I mean, when we're talking about healthcare for the masses, they want to do it at an age where you're going to find positives. Like, you're going to find people with osteoporosis. I don't want to find osteoporosis. I want to see osteopenia or even just decline over years, and I want to get to it earlier. And so I think people assume that if insurance doesn't cover it, it's not needed or it's going to be super expensive, which is not true. I mean, I think our patients pay about $40 for DEXA scans.
Oh, yeah, and that's totally worth it. What was the other thing that you gave me to do? There was a DEXA scan.
A calcium score. Calcium score is a CAT scan of your heart. So it is a very quick CAT scan. I mean, it takes you longer to take your shirt off than to do the CAT scan. You don't use any dye. You take a couple breaths, they take some pictures, and you're out. And so it looks at the coronary blood vessels, which are the blood vessels that take oxygen to the heart. And it's looking for calcifications, which means you have hard plaque. So whenever we have plaque in our blood vessels, it starts as soft plaque, then it turns to hard plaque once it gets calcified. And so you can see that on a CAT scan. So that means you have the beginning of atherosclerosis in your blood vessels. And you don't have to do a stress test to see that. You don't have to do a heart cath to see that. You can do it with a simple CAT scan. And so more and more cardiologists are doing them, but I did them as a primary care doctor all the time. You can get them at Ohio Health, OSU. You can get them at outside places, which is where we send our patients. Insurance never covers it. So whether
is that expensive?
It's around $100 to $125.
Okay. But still, I feel like for your health, I mean,
yes,
it's doable.
Because then, like, if you have high cholesterol and you don't want to go on a statin, say, or you just want more information about, or you have a family history of heart disease and you're like, okay, my cholesterol's good, but like, what else can I know? It's a really simple test. And if you have plaque, we've moved past prevention. Now we're on to treatment. We have to be a lot more aggressive.
What about the full body scan thing that's
like the
happening
MRI for cancer? Prenuvo is a big,
I think that might be.
yeah, it's a big company
Yeah.
that does it. And it's about, from last time I looked, it's a little under $2,000. So the hard part about that is that you get information that you can't unknow, right? And so sometimes we find things, we call them incidentals. So you find things sometimes that you wish you didn't know and don't really matter. Like if you have a cyst on your liver, a cyst on your kidney, and then you have to go down that path because you have to make sure it's a cyst. So then it's more tests. And so I just warn people about the information that they're going to get, kind of like genetic testing. You know, people want genetic testing, and some genetic testing I think is great, but others it's like, if I don't have anything to do for it and I'm just going to cause undue anxiety.
Yeah, I can see where you would be going down sort of a rabbit hole.
Yeah. Yeah. There's also, as far as like cancer detection, there's something called a Gallery test. So a Gallery test is a blood test that looks at DNA, but it's not a genetic test. It looks for DNA that's outside of our cells. And whenever we have cancer, there are certain like tags that happen on the DNA, the cancer DNA. And so it they've made this like AI computer program that they've looked at thousands and thousands of different cancers, and they know the patterns of tags on certain cancers, and so they compare that to your blood, and so it's another early detection for cancer that is, I think, less anxiety provoking than a full body MRI, and about half the cost. So that's another one.
Wild. Okay, so you gave me some aha moments in that in our follow-up conversation, and one of them was the fitness thing.
Mm-hmm.
And the way you were talking about the law of diminishing returns with some of these HIIT classes, or just doing too much of the high impact stuff.
Yes.
As a woman in her 40s-ish, 50s-ish. So let's go into that a little bit.
Yes. I think it's important to make sure you know your purpose in exercise. Like, what is your goal? And our goals change, right? Like my goal when I was 20 is different than my goal now. You know, my goal now is longevity, it's bone health. I mean, we still want to look nice in our bathing suit, but, you know, our goals kind of broaden. And so it's important to know what kind of exercise you need to get to those goals. And you don't need Orange Theory every single day of the week. Like, that's not helpful for longevity. That might cause injury. Also not helpful if you don't have healthy cortisol levels. And then we're doing, you know, HIIT workouts every day. So as we get older, we talk about zone 2 and zone 5 exercise, and we use breathing to kind of define those. You can use heart rate to define them, but breathing is just easier for people. So not all of my patients are going to go get a VO2 max test to know exactly where their heart rates should be. So zone 2 exercise is, you know, if you and I are running next to each other, I could talk to you while I'm running, but I might need to like take a breath every now and again at an odd spot. That's zone 2. Zone 5 is like, I'm not talking to you at all. And so a lot of times these HIIT workouts, like Orange Theory and things, you're not even, I mean, some people maybe, but a lot of times you're not getting to zone 5. You're in this like zone 3, 4, which is not, it's still exercise, yes, but it's not super helpful for longevity. Or as we get older, what we want to do is keep our fast twitch fibers in our muscles, because those go away the older we get. And so we want to keep those. And so we can do that with some zone 5 exercise, some sprinting, you know, some quick movements. But you just don't need a lot of that.
Yeah.
And I think women, like, we want to be, and I'm in that, like, we want to be wrecked to really feel like we had a workout.
I don't feel that way anymore.
It's good.
It's been a recent sort of, I mean, I've been feeling that for a while. It's been sort of a progression for me where I'm like, why do I feel like I have to like throw my head against the wall? Otherwise it's a waste. And now I'm transitioning more into the heavy strength. Like, I'm not talking like, you know, powerlifting, but just being able to lift up 30 pounds and lunge and really like push my body that way, functional strength, and then just peppering in kind of the high impact sprinting. Now I love a good hike on the Peloton, and I have more time in my day. I don't feel like I have to work out 60 minutes. Oh my God.
Yes.
Or the whole world is going to implode. In fact, if I give 45 really great minutes and I can save that 15, you take the compound effect of that 15 minutes over a year,
Yes.
I just saved a ton of time.
And I have a lot of patients, and I don't know if you're in this category where if you can't do it all, you're not going to do any. You know what I mean?
I am in that category.
With diet, with exercise, with everything.
Yeah.
I have a lot of all or nothing.
Yep.
And honestly, you get the most benefit from doing nothing to anything.
Yeah.
Anything.
And I've
You
learned that over time.
Yes, you don't get that much benefit. Like when it comes to longevity, you don't get that much. I mean, none of us are going out for an Olympic gold here. You know what I mean? Like these little strides we don't really need. We're talking longevity. So going from, a great athlete to an elite athlete, that's not going to probably help you live much longer. But doing nothing to doing anything has the greatest gain. And it's just trying to convince people of that. And I always tell patients, like an object in motion stays in motion. So once you're doing 10 minutes at the gym, you're more likely to do 15 and then 20. The hardest part's going from 0 to 5.
Yeah.
Just getting there.
That I have traditionally had that extremist sort of all or nothing. It's with food and with exercise where it's like I'm either going for an hour and 20 minutes and I'm going to really put myself through hell. Same thing with diet. I have gotten so much better. I've always admired people who can moderate, who can have a 30-minute workout, who can sort of be right there in the middle of the road because the extreme stuff is not, at least for me, has not proven fruitful.
No. And there is
At
a
all.
point of diminishing return.
Yeah.
I mean, more exercise isn't always better.
No, and I'm actually glad to hear that because I have other things I want to do with my time.
Yeah, for sure.
Like I want to be efficient when I'm doing it. I want to add the strength, the stretch, and some, just quick cardio. So I'm not doing cardio a ton. Life is cardio.
Yes.
You can be out there doing cardio all the time. It's a mentality that you really have to get honest with yourself, especially around, late 30s. I would say you start to really wonder, do you really need to be hammering yourself?
I mean, I would say at 35, we start losing muscle mass each year if you do nothing. So I always have patients who are like, I haven't changed anything. I eat the same. I exercise the same.
Yeah.
But I call it gooey. People feel gooier.
Yeah.
And that's because you can't keep doing the same thing and expect you to get better. Your body's changing. Hormones are changing. Muscle mass is going down. So we have to change how we work out. And I'm so glad you mentioned heavy weights. That's what we have to do.
Yeah. And you have to pay attention to all this stuff too.
Yes.
You can't. So if you're someone out there who's doing the same shit you've been doing forever and you're
Yes.
wondering why you're not where you want to be, why aren't things feeling like they're in sync or
Yes.
aligned? Because you have to take a step back and go, where am I today? Who am I today? And what lines up with the needs of me today? And I'm sorry to be the bearer of bad news, but you ain't in your early 20s anymore.
Right.
So be the best you can be where you're at now, but you're not going to do that by being in denial.
Right.
You have to, figure out. And guess what? It's nice to shake it up once in a while and be like, okay, here's my routine today.
Yeah.
It's not maximized. Let's just throw this up and see, get real educated and see what sticks. And
Yeah.
maybe you'll have some new habits that are like, okay, aha.
Yep.
But speaking of lean muscle mass,
Yes.
what are your thoughts on Ozempic and these weight loss
Oh, yeah.
drugs?
So here's the thing. Chronic disease in this country is rampant. And so if we can take someone who is morbidly obese and decrease their weight, we have helped them live longer. That's just the way it is. I mean, we know it's protective for the heart. We know it's great. It's a diabetes medication, so it helps with our metabolic health. So there are a lot of really good things when it comes to that medication and obese patients. The people who want to lose the last 5 pounds, I'm probably not increasing their longevity. I'm helping maybe their mental health, but we don't use it for people who need to lose their last 5 pounds. Now, the bad thing about it is you do lose muscle mass. So if you were to just do calorie counting or Weight Watchers or whatever, you'll lose about 20% muscle mass. So for every 10 pounds, 2 pounds of that will be muscle mass normally. Because we'd like to think we all only lose fat, but you don't. You lose muscle too. So with Ozempic or semaglutide or tirzepatide, you lose about 40%. So for every 10 pounds, 4 pounds is muscle. Now, it doesn't have to be that way. So what kills me is when patients are getting it from who knows where, off the internet. There's no exam, no labs. No one's even taken a weight. You just, get it from, I don't know where they come from. You have to be careful where you're getting it. There are compounding pharmacies that are literally like garages in some neighborhood. So you just have to be careful where you're getting it. But you can combat that muscle loss. And you can do it with eating enough protein, lifting the heavy weights, and we like to optimize hormones. So if you have really low testosterone, it's harder to build that muscle. So we might optimize that quicker on my patients who are on those medications. So you can get around it, but you have to be proactive. And I tell patients, listen, I've been doing this a while, so I'm trying to protect yourself from you because your future self is going to be really pissed at your present self if you don't lift the weights and eat the protein, because you're going to be gooier than when you started. Your metabolism is going to be worse, and you're going to end up gaining the weight back.
I mean, that's my thing with it. Of course, there are so many cases where it's life-saving. Mm-hmm. Absolutely. Like nor am I in a position to even say whether I'm against a drug. I mean, I'm not a medical person. But I get that. But I also know the way we all work in this country specifically, and we want the quick fix, and we want to do what, the people on TV are doing, and you hear this buzzword. And I think for a lot of people, unfortunately, they're seduced by this drug. They're going to start taking the drug, not necessarily do it the way that it was intended, get off the drug. And then the lean muscle mass, that's where I'm like, that's your metabolism. That's your strength. So just be real careful.
And that's why we will track people in our office. So we have a scale that can help us look at muscle mass and body fat percentage to make sure people aren't losing a lot of muscle mass. And then also just the way the body works, when you lose weight and then gain it back, you gain it back as fat. So metabolically, this is why yo-yo dieting over time is really hard on the metabolism, because over time your metabolism slows because you're replacing muscle with fat every time you regain. And so people just need to be intentional.
Yeah. It's a slippery slope. Just have to be educated and, like you said, intentional. So be careful out there. Lift those weights.
You gotta lift those
weights. Eat them chickens.
Yeah. It's like a t-shirt.
Talk about cortisol, what you see, and when your cortisol is high. Like, give me the down and dirty on that.
So cortisol is our stress hormone, but it's responsible for a lot of things. Cortisol has its hand in everything. I mean, think about all of the reasons that your doctor might give you prednisone. You can have rash, you can have sinusitis, you can have inflammatory bowel disease, autoimmune disease. I mean, there are steroid receptors everywhere. Asthma, and we treat with steroids all the time. So it affects every body system. So important for stress, but also helps us regulate our metabolism, which sometimes isn't always the best combo, right? Like, I don't want my stress hormone also being responsible for my metabolism, but that's the way it is. So if cortisol is really high or really low, you can have symptoms. So low cortisol is normally feeling really tired, weight gain, cravings, like salt, sugar types of cravings. Mood can be low, libido can be low. High cortisol, often more anxious. You can still have that weight gain. I mean, some people will lose, but you can still have that weight gain with high cortisol because it increases sugar in your blood. So it puts you at higher risk for things like diabetes, high blood pressure. So that's high cortisol. So we get two pieces of information with the Dutch as far as cortisol. We get how much cortisol you're making over 24 hours, and then we get what your pattern of cortisol is through the day. Because you might be making enough over 24 hours, but if you're flat, you're going to feel tired, even if you're making enough. Mm-hmm. So the pattern does matter, and a lot of us aren't getting the sleep we need to. We use caffeine throughout the day when it might not be beneficial. Our sugar is everywhere. So I often talk about every hormone's friends with a food group. Cortisol's friend is sugar. So if your glucose is like up and down, you're not eating, well-balanced meals, you're not eating protein with every meal, it's really hard to regulate your cortisol if your sugar's all over the place.
Ready to elevate your self-care game? Boss Gal Beauty Bar is a modern med spa offering everything from cosmetic injectables, lasers and microneedling, to medical-grade facials and skincare. Conveniently located in Clintonville, Grandview, Powell, and Easton, making self-care a priority has never been easier. Use code CROFT for $25 off your first visit. We all know the age-old joke, why did the chicken cross the road? Well, in this day and age, cool chicks cross the road and make their way to SZN, a groovy little boutique in downtown Powell, Ohio. Located at 37 South Liberty Street, SZN offers curated apparel, accessories, and gifts from purpose-driven brands. Stop in and listen to Tara's story and the stories of the brands sold within the shop. Ask her why a hen is Zen, and receive four-legged greetings from Wally, the small and mighty shop dog. At SZN, your purchase has a bigger purpose. Mention the awesomeness that is the Carrie Croft Show and receive 20% off your total purchase.
I think one of the aspects of the Dutch that is really important is it tells us how you break down your estrogen. So whenever we are metabolizing, breaking things down, detoxing, you can use all of those words, we go through two-step processes in our body. So this is if you're getting rid of a medication, our cellular byproducts, hormones, anything. So estrogen goes through a two-step process. There are certain pathways that our estrogen can go down that are not as healthy as other pathways. And this could be genetic, could be dietary related, alcohol can play a role. So we'll see people with, for instance, endometriosis. They usually go down a certain pathway. There are certain pathways that can put you at higher risk of cancers. So we can see that information and then adjust using lifestyle supplements and things to help break down estrogen in a healthier way. And I think that's really important for patients who maybe have a family history of breast cancer. I have patients who, a lot of times it'll be like their friend who is diagnosed with breast cancer. And so they're so worried. And we kind of live where we're like, I don't know, we're just rolling the dice and seeing when we get breast cancer, because 1 in 8 in our lifetime will have breast cancer. And so we feel like we have no control, but we do. There are actually things we can do to try to help control our risk. And the Dutch test can help us see that objectively, which is nice because there's a lot of information out there. But it's nice to be able to personalize that information for a patient.
Yeah.
You know, it's hard when you see so much information and it's great. And I'm glad that there's information out there, but sometimes it's so overwhelming. People are like, white flag, like, I'm not going to do anything then, you know?
That's kind of the thing where it's like when you're in a follow-up appointment with you and there's so much information, but I took, several points of that. And I'm like, okay, I'm so glad I know this. Now I have some supplements. And so I feel like do something, right? Mm-hmm. I mean, you're not going to remember every little detail, and it is overwhelming. And there is a lot. There's a lot of levers to pull, but it's your body. It's the human body. There's a million things happening.
Yep.
But I think the more you can sort of listen to yourself, explain how you feel, because isn't that the best way, I think, for a medical provider to be able to really start to clue in? It's like, how are you feeling?
Yes.
And then we'll mesh that with what are the intricacies of what's happening inside of you. But if you don't do anything,
right,
you'll always be where you're at.
That's right. It's not just usually going to change without some kind of action. But I would just encourage people to be your own advocate, talk to your provider. Mm-hmm. And if you feel like you're not being heard, you can find another provider.
Yeah.
I mean, your doctor should listen to you.
Yeah.
And if you have, even when it comes to hormone replacement therapy, if your doctor's like a straight, nope, I don't do that, you don't need it, it's dangerous, and that's the conversation, that's not good enough for us anymore.
Yeah.
Like, medicine has always been pretty paternalistic, like, I am doctor, do what I say kind of thing. Mm. And that's not how it's supposed to be.
Well, I think people are more educated today. We have more knowledge. Mm-hmm. There's more out there. So that has to shift.
Yeah.
For sure.
Who knows your body better than you?
Right.
I'm not going to tell you you tell me about your body.
Yeah. So could someone essentially then, like if they're at their OB, they can test their hormones and kind of give them the replacement therapy or whatever, right? Is that, or am I wrong?
They can.
Okay.
I will just tell you, from what I hear from patients, a lot of people, if they ask to test their hormones, they will be told, we can't test them. They change all the time. And we're not going to do, and that's like the end. Or you can go on birth control. And your hormones do change throughout the whole month. we're taught how they change. Like we can draw out what they're supposed to do. So since we know that, we should be able to test them
Right.
at certain times of your cycle.
Yeah.
Now, there'll be times you might have an off month where you don't ovulate. We don't each ovulate every single month, but we can tell that with lab work. I mean, we're taught this stuff, and then out in the real world, it's like we forget we're taught it.
Yeah.
So, yeah, that's some of the, and some gynecologists just don't do hormone replacement therapy. Remember, we weren't really taught menopause. Like we weren't taught nutrition. It's like a couple lectures and then you're done. You know, menopause was, when I trained, it was like, if you have hot flashes, you give HRT. That was the end of the story. And you just give enough till the hot flashes stop, and that's it.
Well, I think the net of that is ask the question, because I think your OB is your, I mean, I know I have a really special relationship with mine, but you would think that relationship would be a good relationship where they know a lot of, they've seen your vag, for the love of God. Well, you know, you should be able to ask the question, or you have other options. You have Donaldson.
Well, I mean, we're all on the same team.
Yeah, no, for sure.
You know, like at the end of the day, I just want patients to feel better, and they don't have to see me. They can find another functional provider if they want to go that route. They can go to their gynecologist who knows a ton about hormone. I mean, that's their thing. But if you don't feel like you're heard, it's not at least a discussion, maybe think about someone else.
So when I came into the office and had my follow-up with you, it was amazing. Is there anybody else? Is it just you doing all? That's a lot for one person.
No, we have a team, and my team's amazing. So we have a nurse practitioner, Angie. She really does fertility. I mean, she does all hormone, everything, but her focus is infertility. So that's wonderful. And then we have Courtney. She's a PA. So she was urogynecology PA for over 10 years. So she's our girl for sexual dysfunction, low libido, vaginal pain, all of that. Yeah.
She's all about the vajayjay.
Courtney's your girl.
They have someone specifically for vaginas there.
We do. Yeah.
Run, don't walk.
I wanted to order you. They have like socks with clitoris.
Oh, there you go.
And they have like charms
See?
with,
Own it.
I mean,
You have to
we
own
all
it.
have
Yeah,
one.
exactly. I totally
It's
agree.
the equivalent to the penis.
It is.
It is.
It's
Like
just as-
embryologically, it is.
It's just as, if not more important than the penis, dare I say. We should actually do a poll and see which part we think is more important in the whole entire universe. Is it vaginas or is it penises? I mean, they're probably equal because they can't do anything without each other, but I think we should do a poll.
I'm team V.
Vagina.
Yeah, for sure.
You know, I said cloner the other day, and I swear I should trademark that. We get cloners.
This
Guys
is true.
get, but it's like, oh my God, what do you mean a cloner?
This
I'm like,
is
well,
the
figure
second
it
time
out.
I've heard. Oh, what was it?
Figure it out.
Yeah, it was what is it? It was on social media. Someone called it it was a boner, but they didn't call it a cloner. But
They
I like
called
that.
it a voner, didn't they?
A voner? No, I
Well,
didn't
so
hear
my
that.
friend Tracy and I were.
I love that.
She was like, I call it a voner. I go, no, it's a cloner.
I like the cloner.
So good.
Because I mean, that's appropriate anatomy.
Right, it's a cloner. Thank
Yeah,
you.
yeah.
Thank you.
I
I'm
mean,
very
we
into
talk
the
anatomy.
vagina anatomy.
My poor kids, because I'll do some calls at home, so they hear me. I mean, I have my headset on, so they
Yeah.
can't hear what the patients are saying, because anything in our
Yeah.
office is fair game. But when my older one was having her like sex talk at school, I took her. I think we went out for fondue, and I busted out a paper and pen, and I was drawing out everything, and I'm like, "This is your uterus, and these are your ovaries. And your vagina you have 3 holes down there." I think that's how I opened it, because they don't know. They got 3 holes. That's important to know, and that's just anatomy. People should just. That's like.
Yeah.
It should be common knowledge.
Yeah.
You should know what you have.
Yeah. But going back to your team, I like that you have a specific lane for infertility. I'm loving that.
Yeah.
And a specific lane for, like, you want better sex, you want your vag to be, hey, you go and you tune up your Lamborghini, you tune up your Land Rover, go tune up your vagina.
Yeah. I mean, it needs
Tuner. Tuner up.
a tuner for your
Tuner up,
cloner.
Scotty.
I mean, so here's the thing. A lot of different things go into libido. I mean, a lot. So it could be maybe you're just too tired. Like maybe your cortisol so low, you're like, that just does not make my top 10 list today. You're just too tired. You know, maybe you aren't getting aroused like you used to, or maybe your orgasms aren't what they used to, or maybe it's painful. You know, there are 2 parts to painful sex. So you can have low lubrication, or you can have thinning, actual, like the thinning of the vaginal wall. And so It's when my patients tell me, like when we talk about the differences, like if you can use lube and then it's just, my patients will tell me it's just like wet knives. Like it's not a lube problem. It still hurts. It's just wet pain. That's how you know it's.
God, now your walls are thinning and your vagina. It's
everything's thin.
You know what? It's no wonder we're overwhelmed, right? The list of shit we have to think about and worry about, it just keeps compounding.
We have collagen everywhere.
Hold on, let me add this to my list of worries here, Dr. Weston.
Yes.
Thinning vaginal wall.
Yes.
Check.
But I mean, there's a solution.
There's a solution for that.
Honestly, that's the good thing about having a urogynecology PA who knows vaginas, because the answer is not laser for everybody.
Right.
So she'll be able to look and tell you, like, do you have prolapse? Are things falling out? You can't laser that better.
You need some
like
some heavy
sometimes you
lifting.
need surgery.
You need heavy lifting on that.
Yeah, like if you're peeing all the time, you might need your bladder lifted and not a diva. But if you do need a diva, it's amazing. And we have one other person.
Yeah.
And remind me, I have a gift for you.
Oh.
Colleen is our dietitian. So she's our functional dietitian. And so she works a lot within our gut health area, people who have IBS, bloating, all those kinds of symptoms, food sensitivities, and then autoimmunity. Okay. So people who,
All right, I love this. Very robust team, ready to just
I love it.
Take on whatever issue it is, right?
We have a great team.
You do, and now you have 2 locations
We do.
for this great team.
Yes, we
Not
do.
just Bridge Park, but now Lewis Center.
Yes, in Evans Farms. And it's so fun. That community over there is just booming. They had an Oktoberfest in September with standardized brewing, and people came out of the woodwork. The neighborhood is so supportive. It's such a fun area. Yeah,
cool.
It's beautiful.
Well, this has been a treat.
Yes, but...
And let me see what she's got for me. I love when someone comes bearing gifts. Aren't you
This is for
special?
you.
See, take notes, future guests. I'm going to start requiring
You should.
material goods. Is this lube? I love you. Your stock just went just skyrocketed straight up.
Well, I mean, this means so I knew it is
Uber
Carrie
lube.
Croft, so I knew we would be talking about vagina.
Oh my
so I
God,
thought
I love
Uber
it.
Lube was wonderful. So we have this for patients in our office.
Thank you.
Yes.
I'm gonna try
and
this
also,
tonight.
we went to dinner and you said that you were the lube of the dinner. And I thought, this is the perfect gift.
I was the lube, wasn't I?
But I love that. And I said, the lube is it's the part that you don't realize you need until you have it. And then you don't want to not have it anymore.
God.
And that's you.
Thank you so
you're welcome.
much. Well, lucky for you, you're stuck with me now.
Thank you for spreading the word and just educating people on weights and prevention and hormones.
I'm here
love
for it. Listen, we're here for a limited amount of time. You might as well feel the best you can while you're here.
Agree.
And then people around you like you better, your life's better, your marriage is better, your kids are, it's all a ripple effect, right?
It's
so this stuff
true.
has a huge, huge impact. The way you feel inside is it echoes.
Mm-hmm.
So if you have the ability with Donaldson, or if you want to go to your OB first, talk to your OB, whatever you want to do,
Just do something.
Do something. If you're not feeling a 10, you deserve to be a 10, in my opinion. So,
Yes.
And with that, if you're still out there following your girl, follow me on YouTube, Spotify, Apple, or wherever you get your podcast. And until next time, go visit Donaldson, get your hormones checked, make sure you're a 10 out of 10, and keep moving, baby.
I love it. Can I take a picture of you sitting there or a video?
Sweet.